I'm Winsy Ida. Today I would like to present about my case study titled Iron Deficiency Anemia IDA. Introduction. IDA is defined as a decreased total iron body content. It occurs when iron deficiency is severe enough to diminish erythropoiesis and cause the development of anemia. It is very common, especially among women and in people who have a diet that is low in iron. IDA is a clinical state characterized by reduction level of hemoglobin. Due to inadequate hemoglobin, the ability of blood to deliver oxygen to the other body cells and tissues is reduced. Iron deficiency is defined as an imbalance of iron intake, absorption, and iron loss. It is the first cause of anemia. Pallor, fatigue, and dysomnia are the most common symptoms of anemia. Table 1 shows reference range of anemia by World Health Organization 2008. Population of children aged 6 months to 6 years old. If the hemoglobin is less than 11, it is considered of anemia. Children aged 6 to 14 years old, the hemoglobin less than 12. Adult men, hemoglobin less than 13. Adult non-pregnant women, the hemoglobin less than 12. And adult pregnant woman, the hemoglobin less than 11, it can cause anemia. Case description. A 22 years old female Malaysian is presented to the hospital. She complained of fatigue, weakness, muscular dysfunction, and inability to do the physical activities for past few days. There was no clinical medical history. On further questioning, she complained of having excessive bleeding during menstruation from the past 2 months. She also complained of breathlessness and palpitations during her sport training and cramping in her legs. There was no history of fever, drug intake, and abdominal discomfort. The physician requested for complete blood count tests, and the test showed hemoglobin, HCT, MCV, MCH, and MCHC are low, while RDW is high. The white blood cell counts are normal, the platelets are normal. Yet, they requested for peripheral blood film. Under microscope, the red cells showed a moderate microcytic hypochromic cells. The platelets appear normal. In biochemistry testing, the doctor requested for iron studies. The serum iron and ferritin are low, while transferrin and TIBC are high. The doctor also requested for hemoglobin analysis. Hemoglobin A2 was normal. Hemoglobin H inclusion bodies is not detected. Discussion. Hemoglobin HB. HB low means anemia. Anemia can occur when the level of RBC in the blood is lower than the normal. It occurs when the body doesn't have enough of mineral iron. HB is responsible for carrying oxygen to your body's tissues, which is essential for your tissues and muscles to function effectively. When there isn't enough iron in your bloodstream, the rest of your body can't get the amount of oxygen it needs. Hematocrit, HCT, is the percentage of blood composed of red blood cells. HCT can indicate if there is a problem with red blood cells. People with a high volume of plasma may be anemic even if their blood count is normal because the blood cells have become diluted. It may cause from the nutritional deficiencies and decreased in production of hemoglobin. MCV and MCH and MCHC. Mean corpuscular volume MCV is a measurement of the average size of red blood cells. The MCV decreases when red blood cells are smaller than normal, also known as microcytic. Microcytic cells are a sign of iron deficiency. Mean corpuscular hemoglobin (MCH) and mean corpuscular hemoglobin concentration (MCHC) reflect the average hemoglobin content of red blood cells in slightly different ways. MCH expresses the average content, the mass and weight of hemoglobin per red cell, while MCHC expresses the average weight of hemoglobin per unit volume of red cells. The MCHC level can be too low because of blood loss over time, too little iron in the body, or also known as hypochromic anemia. Hypochromic anemia is a condition in which red blood cells have a decreased amount of hemoglobin. Red cell distribution with RDW. It is a measurement of the size of red blood cells. A high RDW means that the red blood cells are vary a lot in size. To determine the possible cause of a high RDW level a comparison is made to the MCV. The MCV is the average amount of space occupied by each red blood cell, yet the MCV seems to be low. This can happen because of iron deficiency anemia. The inadequate supply of iron in your body will cause iron deficiency anemia that causes a decrease in hemoglobin in your blood. Hemoglobin in your blood is essential for transferring oxygen on a cellular level. When there isn't enough iron to make hemoglobin, it will result in anemia, which will decrease your MCV levels while keeping RD levels high. Iron studies. The serum iron and ferritin are in low level. Iron helps to make red blood cells, while ferritin acts as an iron carrier, which is a protein inside the body cells that stores iron. It allows the body to use the iron when it needs. The amount of ferritin in the blood is directly related to the amount of iron stored in your body. If there is not enough iron stored with ferritin inside the cells, it will lead to iron deficiency anemia. Ferritin will reduce when iron intake is low because the body relies on ferritin to release the iron it needs. Transferrin and total iron binding capacity (TIBC) are elevated in this test. Both parameters are typically used along with serum iron and ferritin to evaluate people suspected of having too much or too little iron stored in the body. TIBC evaluates how well transferrin control iron through your blood. If the serum iron is low, the transferrin will produce more. It is because an iron never bound to it. Nearly all the iron is attached to transferrin and help in transportation throughout the body. High transferrin indicate that the body needs more iron. Hence, the TIBC will increase in level as the body makes more transferrin, in which the iron never bound to it. Hemoglobin analysis. This patient is not associated with thalassemia as the test for hemoglobin A2 is normal and hemoglobin H inclusion bodies is not detected. Hemoglobin A2 is a useful test for helping the laboratory to diagnose some genetic mutations of hemoglobin, whereas the hemoglobin H inclusion bodies is a disease that most severe non-fatal form of alpha thalassemia syndrome, which mostly caused by molecular defects of the alpha globin genes. Conclusion. In the conclusion, iron is a vital element for multiple metabolic functions and is the most notably oxygen transport by hemoglobin. IDA remains a common and important disorder and accounts for approximately one half of the case of anemia. Thus, it is characterized by microcytosis and microchromatic with inadequate regeneration. The diagnosis of anemia is confirmed by the findings of low iron stores and hemoglobin level below normal. In cases of ID8, oral iron treatment should be initiated for the replenishment of iron stores. With appropriate treatment, patients with iron deficiency anemia can have a good prognosis as long as the underlying disease can be addressed. These are my reference, and thank you.